actually use IT in transforming and revolutionizing the way care is delivered. Mark is also on President Obama's panel, giving insights into the appropriate use of IT, has been one of the, I think, the proponents of some of the elements of Obamacare and the EMR. Mark, share with us some of your thoughts on standards, but just a quick insight. Yesterday, Mark put up a fabulous slide. This was from a neonatal intensive care. It had probably 7 infusion pumps, 3 monitors, 570 wires, and there was no place in that picture to see the little baby. And Mark said that this is the type of information and data. It's known that you need approximately 42 data points for a clinician to make an analysis and reach a decision. The human mind can individually actually synthesize only 7 data points. So tell us, Mark, what should we do?
I tell you, excuse me, I'm so impressed that through this conference, we've talked about data. And we've talked about data just in about every session that I've attended. And that's kind of unique when you're going to an IT conference, when we want to talk about technologies. We want to talk about iPads, and we want to talk about laptop computers and gigabytes and all these other things. But we have come to a common nucleus, which is data and what can we do with it. I'm a little concerned with all the technology we have out there, and I'm a CIO, so I'm supposed to love technology. But I'm a little concerned that we're getting a tsunami of data, but we don't necessarily understand and can use that data. And that goes to the conversation I had yesterday around standards and how important these standards are and how important it is to begin with the end in mind relative to data. If it's not consumable by a computer to be used in a decision support protocol that a physician or other clinician can absolutely depend upon,
ensure that there are a number of different priorities, conditions, sectors, age groups that are covered within that. Otherwise, the unintended consequences is a point. As far as the huge opportunities, I would say, and challenges of some of the lower and middle income countries that we're working with, we're doing quite a lot in Africa at the moment. And what's fascinating, I was at a seminar with some wonderful people a few months ago in Salzburg, and they said, we talked about technology, and they said, we all have mobile phones. So why aren't we using mobile phones more to fast-track some of the traditional methods that other parts of the world have gone through to
let me assure you, India is using their mobile phones.
Fantastic. And it's not just, I guess, about the measurement, but certainly in African countries, the maternal death rate is still substantially higher than it should be. And so having prompts, apps, guidelines that are there ready to be available for people in the heat of the moment. So bringing guidance to people through technology, I think, is key. So the short answer, sorry, that was a very long one, to your question, is it's very variable, and people in some of the lower income countries would say, perhaps if there were a few people sitting here, we can actually fast track by embedding innovation much quicker than in some of the higher income countries because we are desperate for it.
So I think, ladies and gentlemen, one theme which has come across both conferences on the past 2 days and will probably continue tomorrow is that countries like India, where have so much to do, so much population, but an outstanding tele-density, lends themselves to become the leaders in innovation and in bringing out new solutions in the use of technology across the healthcare space. I think we have wonderful examples, whether it is in our ability to use the mobile phone. Almost 5 years ago, the team in the hospital linked the blood analyzer with the hospital information system with the mobile phone of the duty doctor. And we said that if there was an abnormal value, this moved seamlessly from machine to machine and told that duty doctor, so you imagine if there's a low blood sugar, and you don't waste the 20 minutes that it would take to do this process partially manually and partially automated, and you go completely automated. He can rush to the room, give him a packet of sugar, potentially save a life. The power of life-saving interventions using IT effectively with the knowledge and insight of the clinicians is tremendous. It's outstanding. And I'll share with you one more thing. Professor Potera is somewhere in the audience, the chancellor from Alabama. He said, we look to see 40% of the solutions in IT will actually come from the industries. So what he's saying is, nurses and doctors, please tell us what to do, and then ask the technology people to create those solutions for us. So on the one hand, we have the power of IT with servers and cloud computing and disruptive technologies and pervasive technologies and multiple jargons. But the important thing really comes down to the fact is asking the doctors, what do you want? How can we help you do that? And then finding a way to put it into a replicable framework that talks to each other. I think that's where some of the real answers are lying. Interspersed with that core framework will come the ability to add devices, will come the ability to capture data appropriately and to analyze them. And then, Shankara mentioned very briefly, but I think one of the biggest contributions that J&J has done to many hospitals is education. You put those new technologies out there, you put those new processes, let's continue to share and educate each other on this. So continuing in this theme, because as you probably have all realized, the Chief Minister has given us a few minutes extra. I'm going to do one more round of the mic and say, in 1 to 2 minutes, if there was one intervention that you would ask India to do, or Indian hospitals to do, what would that be? And starting with you, Mike.
That's easy, because you've heard it all both days. I would ask India...
I'm kind, I give all the easy questions.
I was actually sitting with Sanjita 3 days ago, and we talked about, I said, I think there's 3 or 4 things that if done right, could change everything in how we provide healthcare. Data standards, terminology standards, things like the Health Data Dictionary that 3M have, is incredibly powerful and is a standard that's there, it's achievable, it's usable today. We use it at Intermountain Healthcare. Secondly would be data standards in the format of the data as it's used within the computer systems. Things like the clinical element model developed by HL7 under the format of CIMI is an incredibly strong structure for understanding the data in your systems. Those two, combined with things like identification and transport standards, allow for tremendous benefit in allowing for the exchange of data, but more importantly, allow for the exchange of knowledge. And that knowledge raises all ships, allows people to be to have the benefits of the greatest knowledge of healthcare delivery anywhere around the world brought to them. I think that's going to save millions of lives when done appropriately. And because you're just a beginning infrastructure, you have the opportunity to put that in place today, whereas in the United States, we're going to have an incredibly difficult time moving to that type of standard.
So data standards was the important point for those of you who were asked by volunteers to sign on a big paper outside and you were wondering what it was. Yesterday, inspired by the like-minded people in the room and the fact that many people understood that earlier, we made what was called the Cyberabad Declaration. We being in Cyberabad, the Cyberabad Declaration was to say that as hospital providers, as industry leaders who are supporting healthcare, as IT people who are working in healthcare, we will together work to create a common standard and terminology. We will adopt global standards and we will move to the government to say, please legislate this so that we're not creating silos of information that does not talk to each other. The idea of standards will move from the clinical standards aspect to locational standards so that the UHID or the unique healthcare identifier or the Aadhaar is used to identify patients, and then move on to other areas and aspects of standardization. So I'm sure all of you will be part of the Cyberabad Declaration. I request those of you who haven't signed the paper outside to please make sure you do. This will then travel to Delhi, where the Union Health Minister will be accepting that. And this evening when Sam Petroda speaks to us, we'll be telling him about that as well and getting his signature on it. So Shankara, 1 minute, what would you ask hospitals to do if there was one important thing? Mark said it was standards, you can't use his point. Give us a new point.
My new point in terms of what the hospital should do is that I think the patient safety or infection prevention or any of these topics, in my opinion, is not, many times, this is not costly. This is not going to add to the cost. Many times, if done well, they actually improve the quality, efficiency, and then actually make the hospital even financially a better running model. And there are so many papers, publications available in terms of how this model really works. I would like to just go back on standards just for a bit, not really to talk about standards in any length, and Dr. Gyani also you referred to about 25 indicators that people have to report, etc. In my opinion, the standards really is the bare minimum. It's a kind of an entry to deliver a quality health care. It's something what we know in India as common minimum program, right? It's the minimum. But we need something called common maximum. Now, common maximum is really the patient safety. Now, if you have to do that, there are so many benefits that the hospital would get while offering patient safety to the consumer. So I think that's where I think the topic comes in terms of the IT. How do we integrate IT to deliver that common maximum? In my opinion, I would say that investing in patient safety and in infection prevention practices is a great way to go for the hospital, both in terms of what they do to the patients, also how they can run the hospital themselves.
That's perfect, Shankar. Thank you. I think what he's doing is inspiring us to say, he took the definition of standards to a different level, which is the bare minimum of standard that you would apply. Mark's allusion to standards was in how do